Very good morning to all. Today we will continue with the abnormal uterine bleeding. In last class we have seen the menorrhagia. Next that is a metrorrhagia. Okay. Menorrhagia that is a heavy menstrual bleeding at regular interval. Next metrorrhagia that is commonly called intermenstrual bleeding. Okay. That is at a irregular interval and that's from the vagina, okay, and that is not associated with the menstrual cycle. Means the girls or women they are having the bleeding, but that is intermenstrual, means it is irregular at any time between the menstruation the bleeding can be there. Okay, so the definition that is intermenstrual bleeding, it is a vaginal bleeding that occurs at irregular interval and is not associated with the menstrual cycle. Now causes of the metrorrhagia. Okay, before moving to the metrorrhagia, why metrorrhagia that is needs to be identified, because it may be a sign of the underlying disorders, because the mothers or girls they are having only the regular menstrual bleeding. In spite of if there is any bleeding, then it must be notified that there are some chances of the any disorders, and it can also increase the risk of the anemia among the girls or the women. Okay, so that's a bleeding, but that is not associated with the menstruation. Okay, the causes of the metrorrhagia, they are many causes of metrorrhagia. In that, first that is a hormonal imbalance, because hormones they are mostly regulating all menstrual cycles, bleedings, ovulation, all the things. Okay, so if hormone imbalance is there, then it can lead to a metrorrhagia. Next it is abnormal growth, means any abnormal growth of any tumors, any lymph nodes are there, any polyps is there, then it can lead to a metrorrhagia. Next it is a pregnancy complications. Okay, if girls or women they are having any pregnancy related complications are there, then hemorrhage can be there, and that is also known as the metrorrhagia. Next that is a infection. Infection that is any infection in the genital tracts, endometrium, any inflammation is there, then it can lead to a metrorrhagia. Okay. Next, certain conditions in the uterus or in the cervix, they can cause the abnormal bleeding. That conditions they are any fibroids, polyps, any scar tissues, inflammation, or cancers. So they can also cause the metrorrhagia. Okay, I'm repeating the causes. That is first, that is hormonal imbalance, abnormal growth, pregnancy complications, infection, and conditions that is fibroid, polyp, scar tissues, inflammation, or the cancer. Next, it is a miscarriage or an ectopic pregnancy. Okay, miscarriage that is abortion. Okay, the products of the conception they are expelled out from the vagina before the viability. That is 24 to 28 weeks. That is known as the miscarriage or abortion. Next, that is ectopic pregnancy. Okay, as we have discussed that the uterus it's a normal size for the implantation of the fertilized ovum, and the continuation of pregnancy is there. Next, ectopic pregnancy is the fertilized ovum that gets implanted outside the normal uterine cavity. Okay, so uterine cavity except that if the ovum is fertilized, for example it is implanted in the fallopian tube, it is implanted in the cervix, it is implanted in the abdomen, then that is known as the ectopic pregnancy, means other than the uterine cavity that is growing abnormally in the fallopian tubes, it can cause the bleeding. Okay, so miscarriage and ectopic pregnancy it can also cause the bleeding, because miscarriage that is abortion. So products of conception, they are coming out. And ectopic pregnancy, there are very less chances of continuation of the ectopic pregnancy, and it is continue for only up to first trimester. That is up to only the uh, 12 weeks. Okay, after that it will be ruptured. So that is a bleeding. Next, it is a intrauterine device. Okay, intrauterine device, that is mostly a copper T. It is used for the birth control, and the copper T can also cause the metrorrhagia. You may know the complications of the copper T. Certain chronic conditions such as diabetes, blood clotting disorders, thyroid disorders, it can contribute to a metrorrhagia. Okay, so I'm repeating this one: miscarriage and ectopic pregnancy. Miscarriage, that is abortion; ectopic, that is fertilized ovum implanted outside the normal uterine cavity. Next, uses of intrauterine devices, copper T for the birth control, and chronic conditions, that is diabetes, blood clotting disorders, and thyroid disorders. It can contribute to a metrorrhagia. Next, symptoms. Symptoms, from the definition we can identify that the women, they can experience a bleeding that may be light or spotting, but it is at a variable timing. Okay, some people who menstruate regularly, they experience light bleeding or spotting at various times throughout the cycle, and especially at the time of the ovulation. Okay, so women need to notify that these signs, they are around the timing of the ovulations. In these cases, symptoms such as mild discomfort and spotting at mid-cycle may not be unusual for a person, because there are no chances that the other than the menstruation there are any single amounts of the bleeding. So it must be notified and it must be unusual for a person. The main symptom of metrorrhagia is light to heavy bleeding. Means there are chances that the bleeding, it can be light, very small amounts, it can be spotting, or it can be a heavy bleeding between a regular period. There may or may not experience the cramps or abdominal pain with the bleeding. Okay, as during the normal menstruation there are cramps and abdominal pain will be there, but under the metrorrhagia there are chances that it may be cramps or may not be a cramps or abdominal pain with the bleeding. Next, certain tests that we needs to do for the metrorrhagia, there is a blood test. Okay? A blood test to check for the disorders that causes a bleeding. Nutritional deficiency is there, infection is there, markers of the inflammation, and other findings. Okay, this also includes the hormone. Okay, so basic blood test needs to be done. Next test to check the hormonal level, because that is a cause. And next is the thyroid function, because thyroid is ultimately regulating all these functions. Next, urine samples to check for pregnancy, because there one cause is that there are chances of the pregnancy complications, that the miscarriage is there, then ectopic pregnancy is there. So to know that urine sample must be checked for pregnancy confirmation, infection, or sexually transmitted diseases. Next, ultrasound, that is USG examination of the abdomen and pelvis, including the transvaginal ultrasonography. Okay, you may have seen that the abdominal sonography, but under the mothers of the antenatal mothers or some other conditions, the transvaginal sonography, that is through the vaginal route, the scope is introduced and sonography is that is carried out. CT scan and MRI is done. Pap smear to test for the cervical cancer, other tissue biopsies to look for other types of the cancer. And lastly, surgery, that is a laparoscopy and laparotomy. Okay? So these are the lab tests needs to be performed under the mothers with the metrorrhagia. In that, simple blood test to check for the disorders. Second, hormonal and thyroids, urine samples, ultrasounds, abdominal and transvaginal TVS, CT scan and MRI, pap smear, tissue biopsy, and lastly surgery, that is laparoscopy and laparotomy. Here two terms are there, that is laparoscopy and laparotomy is there. Okay. So the difference between laparoscopy and laparotomy, that is one thing, that is they are used to visualize the internal organs. But a scopy, that is where requires very small incision, and a tomy that requires a big incision over the abdomen. Okay. So they are both to check for the abdominal and the pelvic organs, and the difference, that is a laparoscope, that is a very small incision or minimal. Laparotomy, that is a large incision such as the cesarean section. So that's a difference. And they both are used for the examination of the pelvic and abdominal organs. Next, the treatment under the metrorrhagia. The treatments under the metrorrhagia, that is simple basic treatments. In that first, that is a lifestyle changes. Uh, in some cases, the condition may be temporary and responsive to the changes in the lifestyle. May be able to treat the discomfort with over-the-counter pain relievers. For example, that are the non-steroidal anti-inflammatory drugs in that most commonly used, that is ibuprofen. While work on reducing the stress, means the stress is also affecting the hormone level. So women or girls, they must follow the techniques of the stress reduction, that yoga, deep breathing, having a short vacation, getting back on a routine after a vacation. These are the some basic lifestyle changes that are used to treat the metrorrhagia. Next, there is a hormonal therapy, because one cause is that it is a hormonal imbalance. Okay? Some people, they decide to use the different types of the hormonal therapy according to the doctor's order, especially the progesterone, to treat the abnormal bleeding. This can include the birth control pills, that is Mala and Maladi. They contains, that is a hormonal, and they can be used to treat the abnormal uterine, IUDs, intrauterine devices, estrogen pads, and other options. And another form of therapy, there is a GRH therapy, that is gonadotropin releasing hormone therapy agonist, may also be prescribed to treat the metrorrhagia. This medication can only be used for a short term, and the hormonal medications, they are having many side effects. Next, dilatation and curettage, that we have already discussed under the menorrhagia, the dilatation of the cervix and curettage, that is removal of the products of the uterine lining. Okay. Procedures, dilatation and curettage, it may be recommended if a woman's they have heavy bleeding, and that is causes other problems like the anemia, because the complication of the bleeding, excess bleeding, that is anemia, and it is not necessary needs to go to the hospital for the DNC procedure. Can often be done in a doctor's office or at a reproductive health clinic. Okay? In some small centers, that is PHC centers, also the DNC is performed. Next, treatment of the underlying health conditions. Means if any underlying diseases is there, for example, severe disease, diabetes is there, sexually transmitted disease is there, thyroid disease is there, then they needs to be treated. Okay? So that is all about the metrorrhagia. Okay? So we have seen the definition, that is a bleeding at unusual timing or intermenstrual bleeding. Next, we have seen about the causes, next signs and symptoms, and lastly the managements. Okay? So that is about the metrorrhagia. Okay? So we will revise some important points under this. Okay? That is intermenstrual bleeding that occurs at irregular interval and not that is associated with the menstrual cycle. The causes, that is hormonal, normal growth, pregnancy complication, infection, and certain chronic diseases. Next, there is a miscarriage, ectopic pregnancy, use of IUD, and certain chronic diseases. Symptoms, that is a bleeding or spotting. The bleeding may be variable. Some women experience only a spotting, some may experience mild and some heavy bleeding. There may or may not experience of the cramps and abdominal pain. Lab test, that is basic blood test, hormonal test and thyroid, urine samples, ultrasound with transvaginal, CT scan and MRI, pap smear, biopsies and the surgery under the laparoscopy and laparotomy. Treatment, lifestyle changes in that non-steroidal anti-inflammatory drugs, that is brufen, and reduction of the stress level. Next, hormonal therapy, progesterone only can be used. Next, IUD, birth control pills, estrogen patch, and GRH agonist therapy. Dilatation and curettage, under the dilatation of the cervix, and curettage under the removal of the uterine linings or the tissues. Treatment of the underlying health condition in the diabetes and sexually transmitted diseases. That's about the metro reach.